in the northern part of the country, we've seen how much education is drawing them back. During the last protest in Kano, we see people destroying roads to get scrap metal to go and sell. We see people destroying traffic lights to go and sell as scrap metal. So even if you put the hospitals in place, you put the legislation, if people don't understand where you're coming from because of their poor education, is a problem. So, I mean, it's a step in the right direction. They need to put the legislation. Then the editor noted that they are trying to get experts, midwives too, in those facilities, get the necessary supplies too in those facilities and educate the people. But generally, we should no longer have generations of uneducated people.
This is Souq Business Landscape. Now, Bauchi is considering a law mandating hospitals delivery to curb maternity and mortality, infant mortality. And Bauchi State is considering legislation that would require pregnant women to deliver in hospitals, aiming to reduce high maternal and child mortality. Now, the proposed laws seek to improve access to skilled birth attendants and ensure timely medical interventions during childbirth. State health authorities said the measure is part of a broader effort to strengthen maternal and child healthcare services, particularly in rural communities where home delivery remain common. Officials noted that hospital deliveries can significantly lower risks associated with complications, infections, and delayed emergency care. Analysts welcome the initiative but urge complementary measures, including improved hospital infrastructure, affordable care, and community sensitization to ensure compliance. They also said enforcement alone may be insufficient without addressing cultural practices, accessibility, and financial barriers. If implemented effectively, now the law could save lives, improve maternal health indicators, and strengthen public confidence in the state's healthcare system. This is one area we have kind of dealt with negatively for a very long time, especially in the northern part of the country. People still prefer the cultural ways of healthcare. It has worked. It can still work, but to what extent have the state invested in those particular cultural ways in the first place? To what extent have they invested in letting people know that a lot of barriers when it comes to culture and religion can be broken? Now they are trying to fight maternal and child, high rate of maternal and child mortality. What should the government be doing apart from just going to pass laws?
They need to do a lot of sensitization, and altogether they need to, I mean, even across the country, we need to declare a state of emergency in education. So because you can pass beautiful legislations, you can bring good initiative, but there is a break in transmission in the communication if your people are uneducated. So they can't even read, they don't understand. Even when it's broken down to them, they can't understand where you're coming from. So in the northern part of the country, we've seen how much education is drawing them back. During the last protest in Kano, we see people destroying roads to get scrap metal to go and sell. We see people destroying traffic lights to go and sell as scrap metal. So even if you put the hospitals in place, you put the legislation, if people don't understand where you're coming from because of their poor education, is a problem. So, I mean, it's a step in the right direction. They need to put the legislation. Then the editor noted that they are trying to get experts, midwives too, in those facilities, get the necessary supplies too in those facilities and educate the people. But generally, we should no longer have generations of uneducated people. we want to see declaration of emergency in education across the country. I think we should no longer have any generation of uneducated people.
Okay, talking about generation of uneducated people, there is this particular policy for those that are watching us, for those that will watch us later, in Lagos that has worked. And that has to do with the primary health care. Yes, the federal government has got a primary health care board that is still putting money in primary health care centers. But now, if you look at Lagos primary health care centers, a lot of them in Lagos are full-fledged hospitals outside this place. And they work. And they are in your communities. You go to some places, you see some kind of funny houses, but all of a sudden you see a primary health care.
Yeah.
Well built and it's working. And the primary healthcare workers also go and reach out to the communities.
Yeah.
How can we start getting other states to copy this kind of things? Because the pregnant woman or the pregnant person or will-be pregnant person in some of these northern states might definitely not be aware of the opportunities available for them to access healthcare, except they are told. Also, there is also the religious part of it. How can we break these barriers?
One of the hardest things, according to philosophy, to break is the religious mindset and cultural mindset of a man. It takes a long process of reshaping their mindset. Maybe you have to take them out of that geographical environment or zone before they see a different, cultural impact in their lives. So as long as they're dealing with them within their space, you have to, of course, behave like a Roman. They say when you're in Rome, behave like a Roman. So if you're going to take this, what has worked in this side of the, Nigeria, for example, Lagos, to that environment, then you also have to do it in a way that comes off like their culture, their religion. They will adapt to it. I don't think there's anything huge or demanding from what we are seeing right now, other than proper awareness given to them. There's this health immunization stuff that they do in Lagos. They go around to give children certain health care procedures and the rest. These are an act or a procedure that can be done in that side as well, to teach them going from house to house. And it's a trust issue as well. There's a trust issue as well to regards to the affordability of going down to the hospital. So once you go to them, you let them know, we're going to enroll you this period to this period. This is something that must be intentional from the government. Okay, we're going to enroll you from this period to this period. And this is how much it's going to cost you. Can you afford it? What can we do for you? You have to be open to them. You have to give them that sense of ownership to these resources that you are bringing to them. Because if you just leave it as, we built an healthcare, and let's not lie to us. We've seen times without number, countless of times, we've seen what it looks like in this part of Nigeria, their health system and structures. It's questionable sometimes when you see some of these videos online on Twitter and Instagram. So this can also take them away from trusting this platform they are trying to give to them. So you have to, of course, when it comes to infrastructure, put this in place. And when it comes to awareness, you have to go to them as well. Explain to them what the benefits they get, the dangers that are in. And because when we talk about danger, we talk about benefits. These are people that what they've known is they've seen their sisters, they've seen their siblings, their aunties give birth within within their beliefs. So it's hard to just wake up and say you want to push them from that to the health system you're trying to design for them, despite the fact that they know that some of them they've lost family members through this cultural or religious way of giving birth to children or taking care of their children. It's just what they believe. I was at the hospital on Sunday and I saw a woman rushing with a child. The child looked malnourished, and you could tell from the other lady that followed her, she was making in a language, or saying things like, I told you, let's come to the hospital. Don't use these things you've been using. And the doctor asked, so what have you been doing to this child? And then she mentioned what she has been doing, personal health measures from a cultural belief here in Lagos. So it's not really about Lagos or West or South. It's just about what people believe. And to eradicate or to change that mindset, then you have to be intentional about showing them the benefits, showing them the dangers that they can actually stay away from if they get in line with what you're trying to design for them. you.